All right, welcome to The Explainer. Today, we're jumping straight into Japan's pharma scene, and we're pulling the biggest insights from the CloseDi newsletter. We're talking major breakthroughs, some really tough challenges, and get this, a surprisingly human story that you're definitely going to want to stick around for. So, let's dive right in.
So what are we talking about exactly? How about a spray that can stop a seizure cold? Or a story about how a single simple word, literally just hello, might have prevented a huge medical error? We're going to get into the super high-tech stuff, but also that crucial human touch that really holds it all together.
Okay, first up, let's talk about the new drugs on the block. These are the game changers, the brand new medicines that are just now becoming available in Japan and are set to make a real difference for patients. So, to really get why this first drug is such a big deal, we have to talk about something called status epilepticus. Now, this is not your typical seizure. This is a really, really dangerous situation where a seizure just keeps going, or they happen one after another with no break in between. It's a true medical emergency that needs immediate, fast action. And that's where this new drug, Speedia, comes into play. You see, before Speedia, the go-to treatment was a suppository. Think about that for a second. It wasn't even approved for adults. And imagine trying to use that in an emergency, especially out in public. It's just not practical. But Speedia? It's a simple nasal spray. So easy. It can be used on anyone over 2 years old, and a caregiver or a family member can give it right then and there. It's just a fantastic example of how sometimes the most revolutionary thing isn't the drug itself, but how you deliver. Okay, next up, we're looking at a huge leap forward in cancer treatment. It's a drug called Balversa. This is the very first oral medication of its kind approved in Japan, known as an FGR inhibitor. Basically, it's a pill for bladder cancer patients who have a very specific genetic marker. The whole idea is to go in and shut down the very pathway that the cancer is using to grow. Now, you know when you're talking about this kind of specialized, cutting-edge medicine, it's not going to be cheap, and Balversa is no exception. Take a look at this number. That's over 31,000 yen. And get this, that's the price for one single pill. So the big question is, what do you get for that kind of money? Well, for patients with this specific kind of cancer, who've basically run out of other options, the results are pretty incredible. Clinical trials showed that Balversa reduced the risk of death by a whopping 36%. When you're dealing with a disease this tough to treat, that's not just a statistic. It's a lifeline. And rounding out our new approvals is a drug you've probably heard of. The much-talked-about weekly injection for obesity, Wegovy, has now officially landed in Japan. And, you know, just like we saw with the seizure spray, the cool thing here isn't just the drug, it's the delivery system. It comes in this multi-dose pen that's actually designed to cut down on medical waste, which is a neat touch. So it's amazing to have all these incredible new drugs, right? But there's a catch. Having them is one thing, actually getting them and hundreds of other essential medicines to the people who need them, that's a whole other story. And that brings us right to the pharmacy supply chain. I mean, seriously, what good is a brand new, life-saving drug if you just can't get it? This is the question that keeps pharmacists and patients up at night. All that brilliant science, all that innovation can just fall apart because of a problem with logistics. And look, this is not some abstract idea. This is happening right now. Just this past week, you had recalls because the film was peeling off a patch. You had a drug being completely discontinued because of problems at the factory. You had another one in short supply because they couldn't get the raw materials. It just goes to show you how complicated and honestly how fragile this whole system really is. And all this pressure, all these problems, they take a real human toll. And nothing, brings this home more than a personal story that was shared in the newsletter's diary section. It's from a pharmacist named Yushi. So here's the scene. She shows up late to work. The pharmacy is an absolute mess. It's chaotic, they're short-staffed, and she just feels this wave of pressure and guilt like she has to catch up. Her focus just narrows and narrows until, as she put it, her vision just tunneled. She wasn't seeing anything but that stack of prescriptions right in front of her.
So let's break down what happened, this near miss. You start with the chaos. Then comes that intense tunnel vision as she's rushing, just trying to get through the work, feeling like she's about to make a mistake. And then, the interruption. A colleague just walks by and says, "Ohio," a simple good morning. And just like that, the spell was broken. It snapped her out of it. She suddenly remembered she wasn't in this alone, and she realized how dangerous her frantic pace had become. That single, tiny human connection brought her back, and she's convinced it prevented a serious error.
And the takeaway from her story is so important. Patient safety isn't just about making more checklists or telling people to try harder or be more careful. It's about the system you work in. It's about creating a culture of support, a place where a simple human interaction can be the most powerful safety tool in the entire pharmacy. All right, for our last section, let's pull the camera back a bit and take a quick look at what's happening on the world stage. Yeah, the innovation just doesn't stop. Over in the UK, they just approved something called EURneffy. It's a needle-free adrenaline spray for severe allergic reactions. I mean, another fantastic example of making emergency medicine simpler. And then in the US, there's a new cream, ANZUPGO, which just got the green light. It's a brand new type of treatment, a JAK inhibitor for chronic hand eczema. It's designed to calm down that overactive immune response right in the skin. And that really brings us full circle, doesn't it? We've talked about these incredible high-tech wonders, right? From drugs that target specific genes in cancer to super convenient injections. But then we also saw how a system can be held together by something as simple and low-tech as a hello. So it leaves you with a pretty big question, and I'm curious what you think. As we move forward, what's really going to define the future of healthcare? Is it the next AI-designed drug? Or is it the simple human connections that make sure we get the care we need safely?